this COVID pandemic, lockdown, shutdown, into what has become a much longer year than we could have imagined when this began last March. And we have gathered as a community first weekly in these town halls, and then as the shutdown loosened a little bit, we didn't feel the need to quite do that weekly gathering, but starting in June, we started going to monthly, and we've continued these monthly gatherings since last June with various topics that we thought were of particular concern and an opportunity for us just as members of the community to gather. It's honestly the only thing we do in which it's just members, because we want there to be some place in which we can have conversations as a community. So the structure tonight, anybody who has a question or wants a particular issue addressed, please put it in the chat. It will come to me, and then I will, for the last 20 minutes of our time together, I'll digest them, and then hopefully many will be able to be joined together, and we'll be able to, with our panelists, answer the questions the best we can. We want to start today, I really need to say this, by acknowledging there's still a lot of unknowns in the world. There are things we know, there are things we know we don't know, and then there are a lot of things that we don't know that we don't know. If anything has taught us about this year, that we can't necessarily predict some things that will emerge, and the importance of pivoting and changing and being flexible. So that's a background, of course, that we're trying hard to raise a couple of values together. One value is the Jewish value of pikuach nefesh. Saving a soul in Judaism is considered a mitzvah that actually abrogates any other mitzvah. So for instance, the most Orthodox Jew in the universe will jump into a car and drive on Shabbat if they are taking somebody to the hospital, or doing so would save somebody's limb or life. Shabbat and every rule of Shabbat is considered doche, is considered pushed aside to save a human life. That's pretty amazing when you think about it. And so that principle of making every decision as a community to be reflecting our deep concerns for safety. The second value we have is caring what science actually says. So we have a wonderful science medical team that's made up of doctors Regina Linder, Neil Hoffman, Roseanne Leipzig, and Nate Goldstein, who have advised us all along the way and translated for us the science that's out in the broader world for all of us. So the Jewish value of pikuach nefesh and science are our two guides. We care deeply about trying to do all we can to encourage, to strengthen us as a community, to bring God's presence into our lives, whether it's physically when we're together, or even in all the different ways we've gathered. And we know how hard this year has been. So some months ago, Sabrina Farber, our CBST president, appointed a task force of Harold Levine, CBST's vice president, Lisa Green and Erica Forman, both CBST board members. So the three of them to form a task force called Imagining Our Future, to think through what will be the next stage in the life of CBST. And not to do it on their own, but to solicit input from all the different aspects of the synagogue. So tonight, Harold Levine will be representing that task force and tell us what their work has accomplished up until now and where they are in thinking about our future. Dr. Nate Goldstein will start by representing our medical science team and will give us an update about the medical snapshot of where we are. We're going to focus, I think, on New York City, but I know many of CBST are spread all over. And then Sabrina Farber, our CBST president, will speak about what are the actual things CBST will be doing in the next weeks and months as we tiptoe into hopefully being able to be together again, and to do it safely and to do it with science, informing every step of the way. So with that, I am going to invite Dr. Nate Goldstein. And again, if you have any questions, please put them in the chat. I will be getting all the questions. I'll digest them. And then after the various presenters, we'll provide for some questions. Nate, Goldstein, are you here with us? I know you are, but I don't know where you are. So would you speak? And
I am here, Rabbi.
We'll spotlight your punim, and we'll ask you, and look at that beautiful bow tie.
I can't take the Punim shot. Babette, can you please put the slides up so no one can see me anymore?
Okay, we're going to be looking at the slides.
I hope so. Oh, that's so much better than looking at me. Thank you. Rabbi, thank you. Thank you to all of CBST as always for the honor of speaking to you tonight. Thanks also to the medical team who's been working to advise all of us as we go along. I'm actually in a patient's home right now. So I am gonna, with Babette's help, I'm gonna go over my slides and then I actually have to go. Dr. Neil Hoffman doesn't know this yet, but I'm gonna then pass it off to Dr. Neil Hoffman to answer all of your questions. So Neil, that was your fair warning. So as the rabbi said, I'm really just gonna cover kind of the highlights where we are with numbers and some questions I know that folks have. So Babette, if you can go to the next slide. Great. So as you know, I've done many of these. I always start with the key take-home point. So the key take-home points for tonight are: get vaccinated if you haven't already. You must continue to wear your mask, and you must keep up with social distancing. Now, we're going to talk about that a lot later when Harold and Sabrina talk about sort of plans going forward, but it's imperative you continue to wear your mask and practice social distancing because we don't always know who has been vaccinated or who might be infected but not symptomatic. And as always, your best source of information is available on cdc.gov. Next slide. So again, we're really just going over the latest US and the New York City data. On the next slide. So these are old data. This is what I showed you in February of 2021. I want you to look at a couple of things here so you can see the jump on the next slide. So on the left side, you see that in February, the cases in the US were going down, and you see a big drop in deaths in the US. There were also 27 million cases in the US and 496, one second, there were, 27 million cases and 496,000 deaths. On the next slide are the current data. So the cases have gone up to 31 million. These are data from this morning. The thing that is concerning here is the slope before was cases going down and deaths going down. And you see now, unfortunately, they've both plateaued. Deaths are up, but the one exciting thing is the total number of vaccines now are up to 209 million. So on the next slide, we begin to break this down. These are old data. These are from February of 2021. This is total number of COVID cases in the US. And as you saw in February, the slope was headed in the right direction. Babette, on the next slide, these are current cases in the US. And so you can actually see where that downward trend was, but unfortunately the downward trend has stopped and we've plateaued. You can see on the right now, since February, the cases have unfortunately leveled off. On the next slide, we'll look at the same for New York City. This is total number of cases in New York City now. This is current. When I spoke to you in February, we're in that little downward dip there, and you can see the cases have since then gone up and are starting to trend back down on the far right of the slide. The next slide is this is deaths in the US. So what we saw was an increase in deaths in the beginning of the year. And then I showed you when I spoke to you in February that they were coming way down, which you see on the right. And what you see now on the far right of the slide, if you just want to look at that, the red line, I'm sorry, is the rolling number of deaths. And you see that it has unfortunately plateaued also. The blue is, of course, the cumulative increase in deaths over the last year and a half. So unfortunately, infections are plateauing and deaths are plateauing in the US as opposed to them going down, which is what we want to see. On the next slide, are deaths in New York City. On the far left, that huge red spike is where we were about a year ago. And for a long, long time, deaths in New York City were essentially flat. And you're seeing on the red on the right that unfortunately deaths are going up or flat again in New York City. So they were very, very low, and now they're back up. We're actually seeing this in the hospital as well. The number of cases, we're starting to see them go down just a little bit, but they're still flat. So in the Mount Sinai system, we still have like 300 case people with COVID across the system. So we're seeing the numbers are definitely better. We'd like to see a continued downward trend, and that unfortunately we're not seeing. On the next slide. So this is vaccines in the US. I got to tell you, the CDC is not, it's very hard to find data that are easy to interpret. So I just chose one slide. I admit it's not the clearest. This is percent of populations in the states that are vaccinated. And what you see, this is percent of the total population, and shows you where we are across the country in terms of total population. The dark blue is any state over greater than 25%. So we're definitely doing better. When I showed you a few months ago, the numbers were obviously much lower. So we are continuing to do better with vaccinating. On the next slide. So this is what everybody wants to talk about, right? These are the variants. The bar graphs, we're not going to go over them in detail. What I want you to see is over time, so each of these is a slide later in time, every 2 weeks. Do you see the yellow in the middle? The yellow says B117. So these are actually bar graphs showing you the cumulative incidence of each of the variants. And what we're seeing is that yellow, the B117, is unfortunately increasing. And on the right side of the slide, basically the B117 is the one that people are concentrating on now. So 44% of the variants in the US are this variant, and 28% of the variants in New York City are B117. Which is B117? B117 has an increased transmission rate. It may have increased severity based on hospitalization and case fatality rates. However, the mutation seems to not affect the effectiveness of antibody therapies. That is to say, the therapies we have for people who have COVID that we're treating, the variant has not decreased that. And the one everyone is asking about is the last bullet point on the slide, is it does appear that B117 has minimal impact on the vaccine. So the vaccine seems to still be working on this variant. And this is the one we're seeing most in New York. And so far, we're not seeing that, we're still seeing the vaccine is just as effective. So on the next slide, this is literally taken verbatim from the CDC website. And what it says is we're in a complicated stage of COVID-19. More people are being vaccinated every day. As of yesterday, more than 125, the 15th, that's a few days ago. More than 125 million Americans have received at least one dose, and more than 78 million Americans are fully vaccinated. And yet, as I showed you the data, both cases and hospitalizations are increasing in some areas of the country. The reasons are probably because of emerging variants infecting people who are not vaccinated. I'll say that again, infecting people who are not vaccinated, but because it spreads more easily, it is moving faster through non-vaccinated people. We're also seeing issues around vaccine hesitancy, people that don't want to get vaccinated. So in general, if you've been vaccinated, the vaccines are working, but the variant is spreading faster amongst people who have not yet been vaccinated. So that's really all I'm covering tonight, because the majority of tonight is to talk about going back to the shul. I just really wanted to cover instead where we are with the numbers. So on the last slide, again, If you haven't been vaccinated, please do. You must continue to wear your mask and you must keep up with social distancing. So that's the end of my talk. I'm afraid I have to go back to see my patient, but I'm happy to volunteer Neil Hoffman, who will answer any questions that you have on my talk. Sorry, Neil.
All right. Well, thank you so much, Nate. Really, really appreciate that. And I think it's an important framework to start the conversation in. And Neil, we're going to ask you to hang in there. We're going to hold all questions till after all of the presentations. But we are facing complicated questions about how we're functioning in the future in the middle of a very difficult time. The virus is not over. We're not done with COVID-19. The coronavirus is still among us, and it presents us in some ways with much more complicated questions than when it was just raging and we were in total shutdown. And so there's some agony involved with every decision. And I think a lot of us have felt it also in personal decisions we make, what's safe and what's not safe now that things are opening up somewhat. So for the synagogue, we have to make decisions that are on behalf of all of us and think very carefully with all of this information. So I'd like to welcome Harold Levine, who will, on behalf of the Imagining Our Future Task Force, Lisa Green and Erica Forman, present their findings and their process so the community can know what the group has done at Sabrina Farber's request, the president of our board.
Thank you, Rabbi. I just wanted to say that I am following Nate Goldstein's recommendations. Do you hear me? I am wearing my mask. I have been vaccinated and there's nobody else in my apartment. So I'm social distancing. So I'm going to take off my mask and I put on a bow tie. I figured I would take a hint from them all along. So I'm going to share my screen here and go through a brief presentation about the work of our hold on one second. I don't need my ribbon. Imagining Our Future Task Force. And as the rabbi said, I share this work with board members Lisa Green and Erica Forman. We work very closely together, and none of this could have been done without the collaboration of the three of us. I also want to say that the name of our task force was intentional. We did not just name it Safe Return, but we wanted to make sure that we had a larger remit and that we were looking at what we had learned during these months of shutdown that could be applied in the future, because we do not believe that the future is going to be a return to the past. It's going to be different. Some of the activities to date have included a number of fact-finding and brainstorming sessions. We met with the staff twice, and I will just start this by saying that we have the most amazing staff. Our staff has worked tirelessly to make sure that the synagogue operations continued even under shutdown with severe challenges to themselves, and many of them all of them working off-site, and some of them even winding up moving outside of New York. So I think we really owe a real debt of gratitude to the staff. We met with the clergy, we met with congregational teams, we met with adult education, both clergy and staff. We discussed Limud, children and teen programming. We had talkbacks for both Saturday morning services, the traditional egalitarian and the liberal. We have met often with the medical advisory group, and we've been in contact with senior staff and clergy. We're also monitoring external factors like the ones that Dr. Goldstein just reviewed: vaccination rates among our congregants, infection rates in our community, other synagogues' return plans, and government directives and guidance. And we have an offshoot of our task force, which is a little group, myself, Kenneth, Carpel, Yolanda, and Patrice, who are working on upgrades for the upgraded equipment for the sanctuary offices and classrooms, that is AV, cameras, screens, interactive equipment. And we are meeting and discussing with other synagogues and churches to see what their equipment and production facilities are like to benchmark that. CBST's response to the shutdown has been nothing short of amazing in these unprecedented times. We call it the shutdown, but we have done anything but shutdown. If anything, we have ratcheted up all of our activities. Worship and life cycle events, Shabbat services went online immediately after the shutdown and have improved dramatically over time. We've taken advantage of the video opportunities. We've had service leaders who have been as far as California. And as we saw on Friday, we've really gotten to a point where we have beautiful online services. We had our broadcast quality high Holy Day services. We've now done 2 Passover Seders online. We added a weekly Havdalah and menorah lighting for the community, which we never had before. And we have done numerous funerals, shmirah, shiloshim, shivas, and baby namings online. We've offered support to the community through these difficult times. This is the 16th town hall. We had the Connectors program weekly, now monthly, and then we have the programs Connecting in Community and Mishpacha. Adult education offerings have basically tripled from before the shutdown till now. We have the daily Psalms class, which in its 14th month still attracts 85 people or so. Greatly expanded Hebrew offerings. More than 100 members of our community have studied Hebrew for months with us, and it has shown in how they respond in the Psalms class, and we hear from them how much more worship and prayer means to them. Rabbi Moskowitz's daily teachings, Rabbi Rapport's Lashon Kodesh classes, and starting just last week, Rabbi Kleinbaum's Yiddish literature and translation. This is the richest group of offerings studied by the most people that we've ever had. Membership has grown. We have close to 100 new members, many from outside the New York metro area, some of whom I hope are on the call today. We've continued with special events and fundraisers. We had our June and December concerts, and we have another June concert coming up. We had our celebration of Psalms, and we had a trans convening, which had, I believe, 400 people logged in, not only from all over the country, but internationally, a much greater reach with much more people than when we did this in person. We've had notable congregational team activities. The volunteer work did not stop. The immigration clinic added a second night with volunteers and friends outside of the New York metropolitan area. I understand that we even have a group of law students in California who regularly Zoom in with us to help our friends. Ending Mass Incarceration has done remarkable online programs such as the Board President Initiative and Progressive Prosecution, and Democracy Action Team Resistance Calls and Cards, led by Sabrina Farber, immediately turned to online activities. They have a weekly Zoom for all participants and guidance for at-home activities by their members. Children and teen programming has also remained vital. Expanded Agadah Adventures online, successful teen program, and innovative online B-Mitzvah tutoring, where the children no longer come to the synagogue, but they Zoom with their tutors. Here are some of the main findings that I believe will shape our future. Streamed services can be deeply meaningful and reach around the globe. Many meetings and activities are just as effective and more efficient when conducted on Zoom. Distance learning for adults works for both students and instructors. Online B-Mitzvah tutoring has benefits to both teacher and student. Out-of-town members want to remain involved in services, classes, and programs, both long-term members who no longer live in our area and new members who have never lived in our service area. We need upgraded capabilities for high-quality online services, teleconferencing, and classes. And in-person worship and programs are missed and need to be reintroduced on a thoughtful and safe basis. I want to thank everyone who participated in the member survey. We got almost 100% participation from the people who registered for this town hall. I'm going to give you some top line, but I want to assure you that we read very carefully the many write-in answers, and they've been shared with lay leadership and with the clergy, and will be informing our work going forward. I will also say that the member survey results are respondents to this survey. We have approximately 1,100 members. We got approximately 170 survey responses. I believe that this sample is representative, but it only speaks to the people who responded to this survey. So the first good news is, after watching Nate's presentation on the vaccination rates in general, we are way above that. Over 89% of the respondents to our survey are fully vaccinated with either 2 doses of the 2-dose vaccine or the 1 dose of Johnson & Johnson. For our 60+ members, that is 95%. And I would also like to give a shout out to the vaccine angels, such as Sharon Golub and her associates, who helped so many of us find a way to get vaccinated and negotiate a very difficult system. The survey shows that we are eager to return to in-person services, but only if it's done in a safe and deliberate way. So many of the right-end responses were, I will come back, but I want to be assured that the air circulation is good. Everybody is going to be wearing masks. We will be properly distanced. People will be vaccinated. And yes, all of this is being taken into account. Streaming will remain an important option even after we reopen for both local and distance members. There was a change. We asked people, did you go in person often or always? Did you stream often and always, or are you mixed? And when we compared before shutdown and what people say they will be doing after shutdown, we find a small decrease in the number of people who say that they will always come in person, and a large increase in the number of people who say, you know what, I'm going to use both. And a lot of the comments were, I didn't realize how good streaming was. I had never streamed before, and now it will be one of the ways that I interact with the synagogue. People stream services on all types of devices. The laptop is most popular, and we were delighted to hear that 85% of you have taken us up on your offer and have your own Siddur at home. For anyone on this call who does not yet have their own Siddur and wants one, we still have them. We have a program to help you. If you can't afford one on your own, please contact the office. Here are our recommendations, and understand that they are subject to change. One thing that we've learned is that change is the constant over these past months. Number one, staff will be returning gradually and safely to 30th Street over the summer. Yolanda and everyone else on staff is making those plans right now. Adult education will remain fully online through the end of 2021. We do not, I see Linda Solomon raising her hand, her giving me a high sign. Yes, everybody who's been logging on to all of the classes will be able to continue to log on to those classes. Friday evening services will be phased in gradually starting in June. Proof of vaccination will be required. Saturday morning services will remain fully online through the High Holy Days. When they return to 30th Street, we will have a way of including those who cannot attend in person. We know a lot of people have been attending Saturday morning services who never attended before, and we do not want to lose you. We will retain online community building activities such as Havdalah and menorah lighting that we never had before. We will certainly seek a way to get back to meaningful and intentional in-person activities and meals as safe and prudent, including some outdoor activities. We will be improving our built-in live stream capabilities for services. We will be upgrading on-site facilities for teleconferencing, teaching, and video. And we will continue to provide streaming options for as many classes and programs as possible. With that, I will turn this over to Sabrina Farber, who will give you more detail about the services and talk about the high holidays.
Thank you, Harold. That was a masterful presentation. And I, for one, have got to thank you from the bottom of my heart, thank Lisa Green, thank Erica Forman for all the many, many, many hours you put in to work to pull this information together, to meet with everybody, to talk to friends, to go visit other places, to gather the info. It is truly a Herculean task, and it is ongoing. And we are forever grateful for you for having done that. It is something that the staff was obviously involved in and helped on, but certainly you guys did most of the heavy lifting. So thank you.
Thank you. And thank you for the support that we've been given in this work and the access to everybody and everyone's open and collaborative attitude as we've asked these hard questions.
Great. Okay. Well, good. So I'm going to cut to the chase and really answer the question that is on everybody's mind so we can just sort of move on and get finished. The question you're all asking right now is, what about the high holidays? What are we going to do about the high holidays? I miss everybody. I want to go back to Javits. I want to see everybody. We know that when we had the annual meeting back in December, we did plan to try to do high holidays in Javits and have Masonic the way we normally would. Obviously, things have changed and things continue to change. While we wished we could have done that, we decided that it would not be prudent. The high holidays fall very early this year, as most of you know, literally right around Labor Day. So we don't have a lot of time to prepare, but more importantly, we would not be able to fit a large enough group in Javits. It would not be able to hold us, and it would not be safe. So we are not going to be able to do that this year. However, that doesn't mean that we're not thinking about and entertaining ideas about other ways for people to gather together to watch services in groups, maybe not as huge as Javits, but somewhat smaller. So we will be asking folks going forward about ideas you might have or suggestions. One of the things that's floating around right now is the possibility of renting a movie theater and showing the services on a big screen with a bunch of people. That's one thing. There are other ideas too. And as the summer progresses, we will roll them out in more detail, and you'll have plenty of time to sign up and make up your mind and do whatever is most comfortable for you. So with that big decision out of the way, we were able to focus more on very specifically, how do we go back to the synagogue? How do we go back in person in a way that is safe, but that is also respectful of the clergy, of the staff, of the members, of everybody. And what you saw last Friday was a little mini example of that. We had talked about having occasional services streamed from the sanctuary, and that's what we did on Friday. What we're going to do is we are going to starting in June, and again, this is all conditional on things remaining as they are and the virus not getting worse and there not being sort of new variants showing up. But all things being equal, it is our goal to start having services once a month in the sanctuary starting in June. We will have a small complement of people, so we certainly won't be able to fill the pews the way we normally did on a Friday night. Right now, to be totally honest with you, we're looking at a number around 25. So you'd have to sign up in advance. And as Harold mentioned previously, you'd have to show proof of vaccination. You'd have to fill out a health questionnaire, and you'd have to get your temperature taken. You have to be a CBST member. I mean, you have to be masked, be socially distant. I don't think you can sing. I mean, there's a lot to think about. And I know that this is an overwhelming amount of information that we are sending your way. Just know that we want, as the rabbi said, to keep everyone safe. That's the foremost thing in our minds. As we get closer to June, we'll roll out more information about exactly how you can sign up to go to a service. We're going to try to be as fair as we possibly can. We're not going to let people sign up for every single service. If you go once, you need to wait and let a whole bunch of more people go instead for the next services. As things get safer and as we figure out this procedure better and the protocols, we will continue adding seats in the sanctuary. But again, this is all contingent on health news and the vaccines and the variants and just the virus in general. So we really appreciate everyone's being flexible and working with us. The clergy and staff have been absolute heroes during this entire pandemic. They have worked overtime. They have worked like crazy, supporting us, supporting our community, growing it, and frankly, learning new jobs, because they were now all doing things that they were not doing at all before the pandemic, right? So we are incredibly fortunate that we are part of this community. And we as a board are proceeding carefully, but with so much love, so much admiration, and so much desire and intent for us all to be back together safely very, very soon.
Thank you so much, Sabrina. And I really appreciate all the presentations. I will now answer some of the questions and then pass out some questions to the different panelists and clarify a few things as we're going through. So as Harold said, Saturday morning services, Shabbat morning services through the high holidays will be online. We're waiting to make a decision about after high holidays till the summer, and we see how things go. Because there are more people participating, we'll have to be much more, not everybody will be able to come. But right now we're focusing on getting folks in for Friday night services, and then after the high holidays for Shabbat morning. Same thing with Limud. We are hoping for Limud to be in person. Limud doesn't start until October. So we're hoping our dream is that things will be getting better and better and better. And by the time Limud is supposed to begin, which would be October, by the way, all the high holidays are in September this year. Slichot is August 28th, to give you an idea how early things are. Rosh Hashanah is the Sunday of Labor Day weekend, which I think is September 5th or 6th. So Simchat Torah, everything is over in September. So we're looking at hopefully Saturday morning and Limud being in person, but we're waiting for a final decision until we're a little closer to that date, because from now until October is a long time away. It is our dream and our goal to have Shabbat morning. at least the Shabbat morning that is limud, although one person did raise the possibility, in order to keep kids separated in small enough cohorts, since we have very small classrooms, it might be necessary to use the synagogue sanctuary for some classes. In that case, we can't have services together. So let me just give folks the understanding that we have a very small building. So when we think about social distancing and small numbers of people spread out, it has a huge impact. When Temple Emmanuel talks about having social distancing in a sanctuary that seats 3,000 people, they can spread out a few hundred people very easily. Our sanctuary is small, our building is intimate, we like to say. And so, for instance, if we had to make the choice between in-person Shabbat morning services and making sure limud can be in person, limud would be in person and Shabbat morning services would remain online. If we need the sanctuary to put kids there, those are the kinds of, it's a lot of moving parts. Do you need to be vaccinated for Shabbat morning services? Yes. Every activity that CBST hosts going forward, whether they are in person in the sanctuary or in person outside, and I'll get that for a moment, everybody who's eligible to be vaccinated by age must be vaccinated. If there's a medical reason you can't be vaccinated, you'll have to go to Yolanda Podosinsky with a note from the doctor and an explanation. But other than that, and there are some people for whom their medical status makes vaccination an issue, we need to know who you are, and there will be a process that our medical team will analyze any medical note you have. But anybody coming in for a service of any kind, a bar mitzvah of any kind, will have to show proof of vaccination. For instance, we're planning to do some small outdoor things, right? So for instance, we hope, for instance, Tashlich will be outdoors. To participate in CBST's Tashlich, you'll have to register in advance. You'll have to prove vaccination. We're not going to have an unlimited number of people to come to any activity. If we had 100 people doing Tashlich, chances are that's not going to be super safe, even if it's outside, right? People are going to. So we haven't developed the exact protocols yet for Tashlich, that's high holidays, but our goal is to have some things outdoors. We will start on Shavuot, which is at the end of May. I think maybe it's May 16th and 17th. Rabbi James is going to lead an outdoor Shavuot text study in Fort Tryon Park. But to get the exact location where that's going to take place, you have to register in advance, prove you're fully vaccinated, and we're going to limit that group to about 20 people because we just don't want an unlimited number of people coming together. I assume everybody understands why. I'm not, but yes, so we are going to, over the summer, have some selective outdoor gatherings, but the same protocols will apply. You have to register, you have to prove vaccination, etc. Another thing somebody asked about the CBST, this is my favorite question of all. What about our ventilation system? I love this because I never knew anything about ventilation before. For this year's high holidays, Patrice, who is one of the great heroes of our community, and Yolanda, another amazing hero, we had to do intensive research to figure out what is the right filter system to have. Now, for those of you who are engineers, this might be a normal question in your life, but for me as a rabbi, I have never thought of that question before. CBST also has many filters of different sizes and shapes because we are a very unique space. So we had to track down, Patrice and Yolanda had to track down our filter system before was either it's MERV, which I have no idea what that stands for. MERV is the rating system for filters. We had either MERV 7 or 8, which was the standard acceptable code for a public space that wasn't a hospital. And we increased it to MERV 13. We were very early at this, which is the only MERV rating that eliminates the virus or something or another. You can tell I'm just repeating words I've been told. I don't totally understand. But anyway, to track down a MERV 13 filter in August of last year was impossible. And Yolanda and Patrice, they were unbelievable at tracking it down. Randy let us speak to her head of her building in DC, which is an 11-story building, and they have a huge building staff and access to, what do you call it? Distributors. So the bottom line is, I love the story, but the bottom line is CBST is now outfitted with MERV 13. Write that down. You'll impress anybody who knows. We are now outfitted with MERV 13 filters. As Marcia Melnick would say, that's marvelous. Anyway, I love that. So we have MERV 13 filters in our building, which is the highest level of MERV filters below a hospital. And it is the filter that's recommended for public spaces. Our air exchange, which is the other big question, I've forgotten the number, but it is exactly what it's supposed to be for COVID-19, blah, blah, blah. So we have space, our air exchange is 6, whatever that means, that's good. But what is the problem with our space? And anytime we think about bringing people in, remember, one of the issues, and all of you who have gone to anything now know, everything's supposed to be unidirectional. You're not supposed to pass people who are exiting and people who are entering. Our problem, once you're inside CBST's space, is that the doorways are narrow. How do we move people in and out of the sanctuary without passing each other? So that's why we have to start. Our goal is for Pride Shabbat 2021 is to have some people in the congregation for that service. That's our goal, God willing. We're going to do one more service in May where Joyce, Sam, and I will lead, May 14th. And we're going to bring in a few congregants only invited to practice some of these protocols to see how it'll work. What does it mean to be unidirectional going up and down those stairs? What does it mean if you're in the social hall? We can't have, we will, for none of these services will there be any gathering to eat food. There won't be kiddush afterwards because we can't get people in and out of that floor safely, and we don't want people standing around eating. So we will eliminate the schmoozing and eating part, but we will allow in a certain number of people. Chorus, what about the chorus? This is the heartbreaker of this, right? That singing itself has been such a dangerous form. Right now we're holding off. The chorus will till the summertime to see, will it be possible to have the chorus meet outdoors somewhere and sing outdoors together wearing masks? We don't know yet. We just don't know yet. Right now, it's not considered safe. So there's nothing on the books for right now. The chorus we're having a big concert June 6th, by the way, our big concert, and the chorus is preparing another virtual choir. We are having people do some pre-records in our sanctuary for that, and some things will be live streamed. It's a little easier with musicians who are not doing wind instruments, and we're having a string quartet with a pianist, so we'll have a quintet for some things, but with no wind instruments, who will be in the sanctuary, hopefully pre-recording and maybe even live, but we can't. Singing is going to be the last thing that we can do, and how to do it is very complicated. So Shavua will be our first outdoor CBST activity in Uptown Manhattan, and stay tuned for more details about that. Marcia Melnick, being the incredibly decent person she is correcting me that somebody else in the Psalms class came up with the MERV. That's just marvelous. All right, anybody else in the, I'll go look at the more questions that have come in, but anybody else on the panel want to respond to any of the issues that I've just responded to? Of our panelists?
No, I'm here and I'm listening, and I think you've covered everything that people have asked so far. I'm trying to think of anything that people asked in the survey that we might want to.
Good. So just remember how complicated our building is, not just to put people in the sanctuary, but to move people around, going to the bathroom. How do we have people come through the front door in staggered numbers so they don't pass each other? How do we separate them? How do we make sure we're following all of these issues? So I'm saying all of that not to be defeatist or down about it, but I want everybody, our community, to appreciate how complicated these issues are. I am so eager to be back leading with a room full of human beings So I share all of that with you. It's fun to lead with Joyce and Sam in the room because we can create together. Joyce and I can communicate together. I can actually speak over her piano playing. She could play under me. Joyce and Sam can dance together in the music. But it's not the same without all of you there, for sure. So that is for sure our goal.
Rabbi, there have been some people who forwarded emails about outdoor services. And I just wanted to say that I've looked carefully at those. And most of those are synagogues that already have some outdoor space, either a backyard or a roof. And we just don't have any outdoor space to be able to do it. And I haven't seen anyone who's doing it in a public space. The public space option is just really unworkable for us, I think.
Yeah, somebody asked, why don't we go to a local public school and use their play area? New York City, it's illegal for the public school system to rent their space to a religious institution. And also, going to a park is very difficult. What would we, in the amount of money to set up a tent and then move our Friday night Sidurim or our Saturday morning stuff and to recreate, very, very, very difficult to do. As Harold said, the synagogues you hear who are doing that are largely suburban, or they have some outdoor space that they own. Great question, Randy Sarakoff. What about CBST retreat? We have one scheduled for spring 2022. It's on the books. We have the date for it. We've put our deposit moved from last year to next year. Maybe you could look it up. I think it's the last weekend in April for 2022. So God willing, we're having the retreat. We've signed up, we've set up a teen track next year for a trip to the South, We're hoping we're going to do that also in February of 2022. We're imagining, and with the advice, obviously, of everybody we're talking to, that January 2022, the world, if everything keeps going, will have a lot more clarity about things. Secondly, will we have guest speakers for family and friends and other special June services? Yes, we will. Great question. Thank you, Cindy Rizzo. For our first Friday night in June, and that information will go out in, I think, 2 weeks, but we'll all get the peak view. What is it? Preview. The first Friday night in June, which we've been dedicating to lifting up Trans Pride Shabbat, although of course we have trans speakers for all the month for regular Pride. A fabulous young trans, actually they go by them, who used to be ultra-Orthodox, Jericho Vincent, who spoke at the trans convening and was one of the most popular presenters, and fabulous, fabulous person, really up and coming, real leader in the Jewish community, brilliant, creative, great website. Look up Jericho Vincent. On our second Shabbat, we're going to celebrate Jews of color who are not African American, but are from various Mizrahi Sephardi backgrounds. The third Shabbat, family and friends, Bishop Lia Daughtry, who's a fabulous African American Christian preacher and political leader, and one of the great leaders in the Black church community and in the Democratic, the religious progressive voice for democracy. So she'll be preaching on family and friends. And for the Gay Pride Service, Anthony Romero, the openly gay executive director of the ACLU, will be our Pride speaker, which we think this year that's an appropriate voice. And he's the first openly gay, the first Latino executive director of the ACLU. So that's our Pride speaker. How did that sound, Cindy? You okay with all those? I can't see Cindy, wherever you are.
Great lineup.
Yeah, we're very excited. I think it'll be, honestly, it's a little easier on Zoom because people can agree. We don't have to do, like Lia Daughtry is in DC. She doesn't have to come to New York to do it. So it's a little easier because people can do it from anywhere. And in the case of Anthony Romero, he wants to do it in a kind of fireside chat where I ask him questions because he thinks on Zoom it's a little bit more interesting to do it that way rather than a presentation. So Zoom actually opens up a lot of possibilities, and he'll do it from his office. So it's actually, okay. How will CBST handle proof of vaccination? We haven't developed the exact protocol. and you've asked especially for bar, bat mitzvah, etc., we will have that figured out by the time that comes to be. The two B mitzvahs that are happening this year will be online, but starting next year when we have B mitzvahs after October of 2021, we'll develop a protocol for that. We don't yet have that protocol. From Andy Austin, who's thankful we're being careful, but per CDC guidelines, do we have to be so draconian in course of unidirectional movement and other stringent limitations? With masks and MERV 13, momentary closeness should not be an issue. Many houses of worship have been open for months with capacity limits and safety measures in place. Yes, for sure. And we will have capacity limits also. But most of the places that you hear who have been open are much, much larger than CBST's physical plant. And so that's something we have to be really careful about. So yes, the idea that we have only one door in or one door out, yeah, we're going to see for June when we open up. But I don't know if anybody else, if Neil Hoffman, do you want to respond to the question? Do we have to be so focused on the unidirectional?
Yeah, thank you, Rabbi. I think that the biggest lesson of the year has been that what has worked to keep people safe has been several layers of protection, using what are referred to as mitigating measures, and so which are at times imperfect, and therefore as many mitigating measures as one can utilize in a space, understanding what the realities are important to maintain. And so, and as the rabbi has aptly described, there are specific limitations to the space that we're in. But I would kind of think of it as kind of like a Swiss cheese, approach where there are holes everywhere, but hopefully they don't go all the way through. And that includes for vaccination, right? That, vaccination is one, and probably, and a very important one, but only one of the mitigating factors. And so it's important to see them as protective and necessary until we know otherwise. And the CDC recommendations, I think, are important as guides, but they don't necessarily, the CDC is, trying to help different settings think about what are kind of the practical issues, and they're weighing, trying to get people to travel more, and, they're trying to keep people safe, but understanding what are the different exigencies of the setting and of the activity.
And when you think about, thank you so much, Neil, when you think about our space, which legally can fit 299 people, we never were able to fit 299 people in that space, because guess what? Those were made for, how shall we say, human bodies that most of us are not. Say no more, right? Anyway, so we have to think about, okay, what does it mean to spread people out, even in the balcony and downstairs, where we now have cameras set up so that we can make sure we're accessible to outsiders as well as insiders. And so that's why we're having a few people each of these nights. We had a few people there Friday night. We'll have a few people May 14th so that we can figure it out, how to keep people, get them in and out of the building, and then when they're in the sanctuary, in a safe place. And Sam is singing, so we have to keep people far away from that, because that's, we want Sam to be singing, but we need to make sure people are without a mask. He is vaccinated. The vaccine is not 100% also, right? That's what Neil is saying. We have to keep being aware of these things at this stage. Again, more things will be information. So Sue Rosansky's asking, could small services be held in a park where people each bring a prayer book to the synagogue and not have to transport anything there other than one service leader? Could be limited in size like the RMJ learning planned in a park. So you don't mean for Shabbat morning or Friday night, or you mean, I'm not, because that wouldn't work for Shabbat morning, but maybe you mean for Friday night?
Well, actually, I meant more for Shabbat. Why wouldn't it work for Shabbat morning? I don't understand.
Well, we'd have to bring a Torah, and we'd have to bring enough people who can lane. I mean, and then how would the people who can't be there do it? Like, how
Okay,
could
I guess I was thinking of a Saturday morning service, doing it without a Torah. I guess that's what I was thinking. Or, an afternoon service on a Sunday, perhaps?
Yeah, so we can, once we break the barrier with what Rabbi James will be doing on, I don't think we could do it for a Shabbat thing, because also if that replaces what we're doing in this, online where people can join, what we would be saying is we're having multiple services at once, which I think is right now very difficult for us to do. But maybe, I don't think you're wrong. Maybe there's a possibility of doing some things, but then again, people can't sing unless they're really far apart from each other. But yeah, we're thinking about all different outdoor things for the summer. We haven't come up with that plan. We're starting with one. We're seeing how well. And think about every event we do requires registration, proof of vaccination. So we have to set up systems in the office and staff people to handle all of these procedures to make sure it works well. And we're at every event, like Rabbi James needs another person to be there to make sure registration is there, making sure their people are following protocols. So everything requires a lot of systems. Nothing prevents a small group of CBSTers talking to each other and saying, let's go over to each other's house for Friday night and watch services together if you are comfortable with that. Let's gather and do X, Y, or Z in small groups where you decide what your safety protocols are. Once we as a synagogue sponsor something, we have a moral obligation to do it in a very systematic, careful way. But I totally agree with you. We might be able to think of other things like what Rabbi James is doing. We can't do it where there's a Torah service, but there are other services for sure. We could have, a healing service. That's just a gathering and things done. Absolutely right. And we will consider it all now that we're at that stage. Yeah. There is more homeless on the streets and surrounding area. Will there eventually be more security? I don't understand what that question is. I guess you mean inside of CBST when we have events? We will go back to having security when we have events, which, by the way, will then begin costing us a lot of money. And Yolanda has communicated with our security company that every security person has to be fully vaccinated. And the security company came back to Yo and said, thank you for saying that, because we've had to send our guys into places that don't have such protocols. And we've had a couple of our employees get COVID as a result. So we are saying even to people who work for CBST inside the building, they will have to be fully vaccinated as well. This will be a general protocol for the building. But so I'm not sure I got the security issue. We won't be having more security than we've had in the past, which I think has been adequate for our building. If there's something else you need to clarify in that question, please do. So our space downstairs is no longer available till rent until when? Yo, do you want to respond to that question about questions about renting our space? That's been on the table as well.
Sure. I'm wondering, is this for a personal event, or are you talking about an organization that wants to rent?
Lisa asked the question. She doesn't indicate.
Oh, okay.
These are not my questions, Yo.
Oh, okay. No, I understand. I understand you're reading them, and I'm like, who asked that question?
That's Lisa Padilla, and I don't know.
Oh, Lisa Padilla. Yeah. So I think as the rabbi and everyone else was describing, things are going to start to fall into place, and it's very hard. We could say, yes, let's, sure, people can rent the space. But there's so many requirements that we would have to, right now we're telling people that you have to be vaccinated. We are calling our vendors, not just security, our HVAC people, etc. So if we're setting up guidelines like that, we would have to say the same thing to anybody that walks into this space.
Absolutely.
So I think the answer is we're going to wait. We will do it, but we're going to wait.
So question from Jason. Can you talk more about the high holiday decisions? Like if we can have services in June, why can't we have some form of in-person high holiday work? First of all, we are thinking about some pieces, like maybe Tashlach, obviously, and maybe having we're not making the final decision because we kind of want to wait to see how this goes. So where some of the services would be able to have some people there, it would be a small number because of the size of the sanctuary. And probably it would have to rotate. So like you could come for Rosh Hashanah evening, but not for Kol Nidre, and people could come for different ones. But Harold, do you want to respond anymore? Sabrina or Yo, anybody else want to respond? Why can't some form of in-person high holiday work if we're having services in June?
I think it's actually very complicated, as so many of these questions are, because once you start going down the road of we're going to go back into the building, obviously our building can't accommodate everybody, and forget about with social distancing, it can't accommodate everybody. The high holidays are a whole other question. I think one of the ways we were looking at it is if we can't go back to Javits in full, which we can't, then we're not going to go back at all because it doesn't make any sense. And I think that one of the ideas we're toying with, this was what I mentioned before about possibly, say, renting a movie theater and having a group gather there if they want to gather in community. We're exploring ideas right now. And in fact, if you have any ideas or you have any suggestions, please reach out to us, let us know. We'll look into them and we will present to you later on in the summer some options for gathering that may be sort of community-based in terms of neighborhoods, or maybe it will be in terms of, say Mishpacha and Aleinu. We haven't quite figured out the details yet. And again, a lot depends on what happens with the virus between now and then. We are looking, as Rabbi Kleinbaum said, at having a few people in the sanctuary for high holidays on a rotating basis. Again, quantities, numbers are unclear right now, but it would be very much rotational. So you'd go for a little while and then you'd have to leave and new people would have to come in. It would be a tremendous amount of moving around. And I'm not yet convinced that it's something that's going to satisfy people. However, we're talking about it. It's on the table. And again, we'd love to hear ideas from people who have other thoughts about gathering in groups, for the high holidays.
Yes, Sabrina and I earlier discussed, we have that beautiful broadcast quality live stream of the services, and movie theaters do rent themselves out. And would we want to rent out a movie theater for whatever New York City regulations are at that point and stream the services? I know that most people now also have their machzorim, but it would mean, there's a lot of work to be done. Who would be there? I know when we've even streamed downstairs, we've had a member of clergy or an intern, someone helping to lead this, to create that sense of community. So it is something that we're thinking about, but it's something we're thinking about to see it, because that would actually let more people get together than we would ever be able to get into the building, because the requirements of the cameras and lighting, whatever, it's really very limited attendance in the sanctuary for the high holidays.
And you all understand that it's complicated because a decision has had to be made last month about high holidays. We can't wait until, August to be able to make that decision about where. So we have to do the best we can with the information that we have. So like shofar sounding might be outside. There might be elements that we'll be able to do outside. How do you plan to determine who will be able to attend a Friday night service in person if there's limited capacity? We've had a lot of discussions about which systems. We've talked to a lot of different synagogues about how that happens. Probably people will have to, when they register in advance, it might be like a first come, first serve. But if there'll be 3 or 4 services over the summer where you could come, probably if you get into one, you can't come to another one. You don't get double dipping for the summer services, and we'll make it clear that it'll be a transparent process. But likely what other synagogues have done to make it fair, first of all, it's only going to be open to members, which is the first time we've ever done that. And it's going to be something like where you register, first come, first serve, but then you're taken out of the lottery for the rest of the summer. And then we'll keep a waiting list because people cancel, we'll take names, et cetera. It's probably going to be something similar to that. That's what in our canvassing of various synagogues seems to have worked when there's a limited number. And honestly, a lot of people don't want to come there. Well, and we saw there are some people that, excuse me. Neil, would you like to say something? You have something else to say about the DOH? Neil Hoffman?
Yeah, just that, you know, we're compelled to follow the state Department of Health guidelines around larger gatherings. So which obviously is evolving as, you know, as time goes on and as the indicators improve. So that's one constraint that the synagogue needs to be mindful of. And also I think that the screening procedures, which are just going to get piloted in the next, you know, next month, will be burdened, you know, increasingly as the numbers go up of attendees. So, and we just really want to make sure that those screening procedures can accommodate that. So, you know, there's efficiency of entry into a space, and being aware that people are meeting the criteria that have been set up.
Rabbi, one of the other things that we heard clearly when we talked to people was that we don't have a neighborhood synagogue per se, and people don't drive. And people were as concerned or more concerned about being on the subway, the bus, or the train getting to the synagogue as they were being inside the synagogue. We can control the MERV, et cetera, in our synagogue, but we can't control it in the subway. And even when people are vaccinated, I think that people are still leery of being out in public and taking public transportation.
And yes, Harriet and Ruth asked, are we using the same machzor this year? Yes, we're using the same machzor as we did the, what's it called? Lev Shalem, I think. Lev Shalem. And when we send out the high holiday mailing, we will once again have all the information. And if you didn't yet buy it, you can buy it. You have to buy it from them. But again, if you need help financially, we have a book fund to help folks. And here we are as the ambulances scream by. Sorry for the, okay. Can the chorus rehearse in person? We don't think so. And I hate, this is heartbreaking. Even to do an online, right now, the answer is no. In 2 months, maybe that will change. And that's what we see. We're in a very complicated moment. We don't have, it's not, as that's why I said in some ways the lockdown part was easier. Right now, we're a little bit in an in-betweenness we don't totally understand. And what Nate showed us, we don't totally understand where the vector is going. We don't totally understand that. So in a couple of months, I think we'll know more about the chorus question than we do now. We wish we really knew. All of us want that to be true, but we don't want to do something prematurely. Anybody else want to answer that question about the singing and chorus, even for rehearsals? I think, yeah.
Yeah, we know that people want to do it. A lot of people said, how about the chorus? And as many people said, I'm concerned being any place where people are singing. The same question asked, if you go to services, will you be able to sing if you have your mask on and you're vaccinated?
We just saw a letter that went out from SAJ on the Upper West Side where they told people you have to wear a mask, you can come to services, 20, very small number, but you cannot sing while you sit there. That's becoming so again, everybody's trying to figure out, we're all in contact with each other. Everybody's building is slightly different. Everybody's culture is different. And what can be done in one setting might be more difficult in another. Let me just quickly look at the questions. I think we're coming close to our end of time. We have a few more time. What about using athletic facilities? As Dean says, they're huge. You mean outdoor? Does that mean if the weather is good? You mean like a football stadium? What does that mean, Dean? Is that what you mean, like going to somebody's football stadium?
I was thinking like high school stadium, there's all those facilities are all over the city and, anyway, it was just a thought.
Yeah. Okay, Harold, put it on the list.
On the list.
I don't know we can't go to a public schools facility. Will Shavuot be the same this year? Yes, this year Shavuot will be online. Services will be, although we're going to do it a little bit better this year, the Tikkun, we're going to have Zoom links for each class. It's going to be last year we had a lot of problems with breakout groups. We've learned so much. So we will be doing it, but we will have that Shavuot afternoon tech study with Rabbi James outdoors. That will be part of the Shavuot time together. Why can't we just rent Javits for members? Javits is a huge outpouring of money that mostly the non-members who come ends up covering the cost of, by the way. But Yolanda, that's from Marilyn Michon, I think. Do you want to respond to why can't we just rent Javits and not allow non-members?
Right. So part of the reason, I mean, is the fact that it would cost us more than it normally costs us, because there's more work that has to be done to set up the site. In fact, there's certain things that we would have to take on, and we would have to hire more security. We would have to, have more seating, spread out. It just doesn't make sense financially.
Yeah.
I'm sorry to put it that way,
Okay.
but
And
that's
the
the
final
truth.
question was, why don't we get a permit from the city to block off 30th Street and have an outdoor service? So let me just tell you, the city will never grant us that permit. We didn't have a permit for the moving in ceremony, and partly is because you can't build anything above, I don't remember the height of it. I think it's 3 feet. You can't have I don't remember. And we didn't have a permit that day. And they kind of looked the other way because they knew we were going to be in and out, so to speak. But had we asked for a permit, they would have said no. It is an emergency responder street. 30th Street is an emergency responder street. So it's one of the streets in the city that's marked for ambulances and fire trucks to go down.
Yeah.
So it's not possible to get a legal permit to close down the street. But good, yeah, I thought of that too. I thought, why can't we do that? But we can't. But listen, I could go around to everybody's house and say hello to you if that'll work for high holidays for everybody. And, I'd be happy to take my car and I'll drive around like during Elul just to see everybody. Why don't we do that? Okay. Not to Florida and Bulgaria. I'll take those off the list.
Rabbi, I'll come with you with the shopping bag that collects the pledges, okay?
Okay. That's great. Maybe that's what we'll do in Elul. We'll have
And we can drop off granola. We can drop off your granola.
For the right amount of pledge, I will make some pandemic Kleinbaum granola for the right amount. Marcia and Susan, you in? We'll take pledges right now. Okay. Well, folks, I think we're at the end of our time. And I just love seeing your faces. Art Leonard, it's been so long. So great to see you, Art.
And Rabbi, I think this is the highest attendance that we've, either the highest attendance or one of the highest attended town halls. And I want to say that the comments that we got in the survey were so loving and patient and supportive that we have the community behind us. And we can't tell you from the board perspective, we do this all, how wonderful that makes us feel. That we are working on your behalf, and we have your best interests at heart, and you understand this and support us.
Because it's all of our interests. We're in this together. There's no us and them, right, Harold? We're all, Sabrina, Yolanda, we're all in this together. We all want the same thing. I would say, what's the email we should offer people to write comments or ask further questions? Should we do the info? Who wants to give out their personal email?
Everyone has my email. I'll put it in chat. Glad to hear, and I'll be collecting them. Well, how about that? Here we go.
I do think
@gmail.com. Keep your cards and letters coming.
And I just want to end by saying this could be the hardest time that we're in, that we have to kind of keep our energy and our positivity and our sense of resilience up just when we feel like we should be at the finish line already. And I'm with all of you in that frustration. But thank God we're at this moment. Not all of our members have lived through this year, and we carry them with us right now. And we hope and pray that we will come through this stronger, more spiritually grounded, a place where God's presence just will continue to grow and all of us will discover new things, and the revelations we will have as human beings will just increase. And and I hope there'll be some looking back on this time as not just a source of disruption and despair, but a time that some of God's truth was revealed to us. It continues to be our obligation to be the reason that other people believe in the goodness of humanity every day. So thank you all for being such a reason. Good night, everybody. Thank you. And thank you to Jesse Katz and to Babette Roberts and everybody who helped set up tonight. Good night, everybody.